Good morning. My name is Jenny Pinnick. I'm a nurse manager for an inpatient oncology unit at St. Anthony Hospital in Oklahoma City. It's really sad that I've been doing this job for a long time, and yet I have to look at my script to tell you who I am. So I'm just a little bit nervous. So you just, what can I say? I've been a nurse for 21 years, and I'm here today to talk to you about things that inspire me and in turn motivate me to try to inspire others. I worked for St. Anthony for 14 years, and before that I worked in a hospital across town. I had worked there for 10 years, and when I was there I loved my job, I loved my patients, I loved my co-workers, but I was offered an opportunity to come to St. Anthony. We were going to open a brand new unit, and so I was very excited about that, but scared at the same time, because you know when you've been someplace for 10 years, you get used to it. You get used to the way that it is, and you really don't know how different a new path can be in a positive way. So I decided to make a move to St. Anthony Hospital. I remember my first day walking across the street. I'm looking up, and I'm thinking how old the building is, how big and beautiful and old. And I walked in the front door, and I immediately felt different. And I looked at the people around me that I didn't even know yet, and I felt different. You see, when I was across town at the other hospital, even though I'd been there for years, I didn't know the mission or the purpose of the hospital. Now, obviously, we were there to care for our patients, but I don't remember ever being presented with the mission or the goals of the hospital. And, as we all know, at St. Anthony, well, SSM, our mission and goals are made very, very clear. And why is that? It's because the expectation is to live the mission and to work hard to achieve the goals. After almost 15 years with St. Anthony and SSM, I've never been sorry I walked into that big, beautiful old building. The building itself stands for history, strength, and sustainability, but the people inside create the inspiration every day. So how can we inspire others? We must set a good example. You have to be encouraging, and you have to be inclusive. And why do we want to do that? Why do we want to work to inspire others? We do it for our patients, we do it for their families, and we have to do it for each other. We try to inspire because we're passionate and excited about what we do. And although my voice is quivering and I'm nervous, I am excited. I'm just showing it in a different way today. We do it for our patients, families, and each other, but we want to do it because we're excited about what we do, and that's provide exceptional care and reveal the healing presence of God. It's about being in the right place for the right reason. So my inspiration for going into healthcare was my grandmother. She was bedbound for 17 years before she passed, and I used to watch nurses care for her, and through their caring actions and conversations, they could determine what her needs and concerns were. So I decided to make a career change and left my job. I worked in an accounting office for a law firm that had 90 attorneys and decided to go to nursing school. So I'm happy to share that my grandmother was still alive and was able to watch me graduate. So I still carry that same inspiration today. Every day I get inspired by those people around me. Sometimes the inspiration's from a patient or a family member, sometimes from a coworker or employee. I'm inspired when I walk down the hall and see a transporter praying with a patient. I'm inspired when I do rounding on my patients on my unit and doctors are praying with their patients. A couple of years ago, I was trying to sneak in the hospital. I'm sure none of you guys have ever done this. Sneak in the hospital at an odd hour to try to get some work done. And I saw Debbie, another department director, in jeans and a t-shirt. And I assumed she was trying to accomplish the same thing, but I was wrong. She had an employee in the hospital, and that employee was dying. And she and her coworkers were actually taking shifts and staying with the patient so that patient would not be alone. That's what inspires me. I recently received a card under my office door, and it was from a 42-year-old woman diagnosed with cancer. It's not a new diagnosis, and the patient who wrote the card actually was still in the hospital as an inpatient and slid in on my door, so I went and visited with her. But I just want to read and tell you what she wrote. I want to say thank you to all the nurses who took care of me. And when I see nurses and I see that phrase, I don't think nurses, I think everybody that walks in that room, because patients think everybody's a nurse some way or another. So everybody gets credit, although the word says nurses. You all made my stay more enjoyable. I always thought cancer was a horrible disease, but all of your wonderful nurses made me forget I even had cancer while I was on the 9th floor. This wonderful nursing staff, with their great smiles and attitudes, made me want to wake up every morning, and I have not felt that way in a long, long time. So they gave me a reason to wake up every day to see their beautiful faces. They're wonderful nurses. There are no words I can say or express about how I feel about the care I received this past week. So this card and story, and many like it, we've all had those, and those are great inspiration. So every day I want to inspire to do a great job. I try to tell my employees how valuable they are to our mission. When I interview potential employees, I ask them, why St. Anthony? We have a lot of other area hospitals in Oklahoma City. Why do you want to work here? And then I ask them, why do you want to work on this unit? I've learned that if they just want a job, that they're not really the kind of employee that I'm looking for. I'm looking for someone that I can inspire, that can inspire me, and can inspire other people around them. As an employee of St. Anthony, I'm going to expect you to provide exceptional care. With inspiration and motivation, hopefully I can help you build that foundation to succeed. Because we need you to understand what SSM, St. Anthony, and the 9th floor is all about. Tina, one of my staff members, recently came to my office for a conversation, and she inspired me when she said, your patient population is your nurses. It's us. You nurse us. Talk about inspiring. That was very inspiring to me. It makes me want to pay that forward. I'm proud to be part of St. Anthony and the SSM family. The mission is clear. The goals are sometimes very difficult to achieve, but the reason behind them is very clear: exceptional patient care. So I'd like to close with a comment made by the Oncology Nursing Society about being present for your patients. The role we play in the lives of our patients is more than the care of the body. It is the nurturing of the spirit. It is our commitment to our patients and those who love them. It's beyond what we do. It's who we are. Thank you.